Hi, so I got a question on my YouTube channel today that I thought would be a good topic for a video. And the question was, do anxiety medications make anxiety worse? So I'm going to address this question from the point of view of the 20 years I spent working with people with anxiety. And just to say, I am not a medical doctor. I was a psychotherapist, so I'm sharing my perspective, and any of this should be checked with your doctor. Okay, so the answer to the question, do anxiety medications make anxiety worse, is it depends what kind of medication. Now, most people who would come to see me for anxiety disorders, I would recommend that they try just therapy or CBT or EMDR to deal with the anxiety for about 6 months to see what kind of progress, because a lot of anxiety disorders, you can overcome them with targeted psychotherapy, working with somebody who really knows about anxiety. So very often you really can recover from anxiety without medication. However, if you've been really worked in therapy and you have a good therapist, and both of those are true, and you're not getting over the anxiety, that's generally when I would suggest that somebody speak with their doctor or psychiatrist to see if a medication might assist the process. And often it would assist the process in situations of post-traumatic stress disorder, panic disorders, OCD, and social anxiety can really benefit usually from an SSRI or an SNRI. Now, SSRIs and SNRIs are antidepressant medications, but they work very well on obsessive thinking. And when I say they work very well, again, it's sort of like they work for some people, they don't work for everybody. And unfortunately, there does seem to be a bit of a trial and error process with this. But best practices for obsessive compulsive disorder usually combine an SSRI and exposure relapse prevention type therapy. It could be a CBT type therapy, but with exposure. Now, there are medications that are prescribed for anxiety other than the SSRIs and the SNRIs. There's a handful of other antidepressants that can work, such as Wellbutrin. And then there are medications from an entirely different class of medication. Sometimes beta blockers can be helpful for people who have social anxiety in particular. Beta blockers can sometimes help with sweating and those sort of visible anxiety signs that really bother people with social anxiety. Beta blockers are really a medical medication that reduces blood pressure. So it's used a lot in people who have blood pressure or perhaps heart issues. But it does have another use for certain anxiety symptoms. Now, so far, the medications I've discussed are ones that are not addictive. The SSRIs, the SNRIs, other antidepressants, beta blockers, they are not addictive medications. Generally, the antidepressants do take a few weeks to kick in, and then to come off of them, it can take some time. And you'll want to titrate off a medication like that with a doctor's help. But now the last class of medications that I'm going to talk about, which is the much more controversial class of medications, are the benzodiazepines. Now, the benzodiazepines include Xanax, Valium, Klonopin, and benzodiazepines are a biphasic drug. I'm going to explain in a moment what that means. But when you take a benzodiazepine, you will immediately feel the relaxation impact, similar to if you had a glass of alcohol. But then after the half-life of the drug is through your system, you will no longer have that relaxation impact, and you actually will have an increase in agitation, which is why you will then want to take the medication again. And so the biphasic medications, they have two phases. They have the one phase where they have the initial impact, right? So for alcohol or a benzodiazepine, the initial impact is relaxation. But what they're really doing is flooding your system with your own relaxation chemicals. So it's not like they're like adding something really new. They're triggering the release of your own relaxation chemicals. So after the half-life is over, you are left with fewer of those relaxation chemicals. And that's why these medications can be addictive. So alcohol, for example, works on a 24-hour cycle. So if somebody's used to having their drink at 6 p.m., right, after work, 6 o'clock, they have beer, glass of wine, drink, they'll want that 6 o'clock most nights. The body gets attached to a cycle. And the benzodiazepines, some are very short acting, some are longer acting. So how they impact you varies by medication. But for the most part, benzodiazepines are never meant to be prescribed for more than 3 months at a time. They're kind of like an emergency medication. I personally would not advise my loved ones to utilize benzodiazepines just because of what I've observed, but I know that that's very controversial. A lot of people are going to get mad at me for saying that. That's my opinion, right? So medical doctors do prescribe these. And for a major crisis in someone's life, a period where somebody really can't function because of the amount of anxiety they're having on a very short-term basis, maybe is what I would say. But in my work, and again, I was working with people as a psychotherapist, not a doctor. So they would come to me either on medication or not. I didn't prescribe. I couldn't tell them what to take, what medication to take at all. I could sometimes sort of suggest like, maybe this is something to talk about with your doctor, or this is my concern. But people would come to see me who'd been on benzodiazepines for years and years and years. And during that time, their panic attacks got worse and worse and worse. And the panic attacks got worse because of the biphasic nature of the medication. So again, this is a controversial. In general, I think medication is a controversial topic. There are people who are like totally against it. And then there are people who are totally for it, right? I'm kind of in the middle. I do think it helps. Certain medications help in certain situations, right? I am not a fan of the benzos. I would very much be concerned because they are not solving the problem, right? And they do one other thing, which is that they make people feel that the answer is outside themselves. Like with an SSRI, when you take it, you don't feel an immediate impact. So people don't make this reference to feeling better to the medication as tightly. But people who take benzodiazepines get very attached to them because there's an immediate impact from the medication, which is also why they're frequently abused. Another problem with the benzodiazepines is getting off of them. The body becomes very dependent on the medication, and it can take a very, very long time to very slowly titrate off because the withdrawal symptoms are strong. Now, there's something that most people don't know, but to detox off of a drug, there's really only 2 that you need to be in the hospital, and they both happen to be legal in the United States. One is alcohol and one is benzodiazepines. So if somebody is taking large amounts, like I'm not talking about, a small dosage, but if somebody's addicted, physically dependent, and taking a large amount of the benzodiazepines and alcohol, they need to be in a hospital to detox off of it. You can actually detox from heroin on an outpatient basis. So it's just something to keep in mind with these 2 very common, very legal drugs or medications, whatever you would like to call them. Now, with panic attacks and agoraphobia, people truly can recover from both of those things with targeted psychotherapy, sometimes assisted by one of the antidepressant medications. Now, since I'm talking about how effective psychotherapy can be, and I don't provide psychotherapy anymore, I did become an affiliate of BetterHelp. They provide therapy virtually worldwide. And the BetterHelp site also has information about treating different anxiety disorders, such as how to treat OCD effectively. And then there are articles on panic attacks. Additionally, you can screen for therapists who live in your area, and you can see what specialties they have, whether they do specialize in anxiety. When you sign up for BetterHelp, you fill out a questionnaire. It asks you a lot of questions. And I'm showing you this one screen because if you are dealing with anxiety and really want to focus on results, I would definitely check that a therapist who teaches you new skills, assigns some homework, and provides guidance about setting goals, super helpful. Obviously, you also want somebody who listens, but you really could benefit from somebody who has a very focused view of it. And finding somebody who specializes in the particular type of anxiety that you have would be super helpful. As an affiliate, I do have a link which provides you 10% off your first month. I'll show it here, but the link is actually in the description to this video. And this channel does earn a small commission, so it's super helpful for the channel. Okay, let's get back to the topic. All right, so this was a quick run through of my thoughts about what medications can make anxiety worse. So what anxiety medications? Because obviously there's a lot of medications in the world and they can have a variety of side effects, but just really focusing on the ones that are most commonly prescribed for anxiety. Let me know what you think. Comment below. If you have a question, as you can tell, sometimes I create videos to answer some of the questions that my audience asks. So I hope you have a great day. If you're not subscribed to my channel, please do subscribe. For tools and techniques to recover from anxiety without medications, you can check out I have a whole playlist on anxiety videos. All right, I wish you all the best. See you next week.